Today I'm going to talk about the best exercises for low back pain. And I'm going to put this into two groups and make this fairly simple. Hi, I'm Dr. Paul Lieber from Regenexx Pittsburgh. For people who have spinal stenosis, narrowing of their spinal canal, and as a result have nerve pain or weakness in their legs because of narrowing of their spinal canal. These are people who are intolerant of arching backwards. When they arch backwards, they compromise their spinal canal, and therefore they become symptomatic. So for these folks, exercises where you're bending forward are the best. These are the people who they can walk for a mile when they're bent over pushing their shopping cart because they're opening their spinal canal. And so for them, actually exercising and pushing the shopping cart is a good thing because they're strengthening their legs, they're getting conditioning, but they're not compromising their spinal nerves. Other exercises for spinal stenotics, and again, these are the folks that are intolerant of arching backwards, are exercises where you bend forward. So we talked about, and I will talk again about bringing your knee, single knee to chest and holding it for 60 seconds and repeating it once. Double knee to chest, holding it for 60 seconds and repeating it once. And passive straight leg raise where you're putting a jump rope or a strap under the arch of your foot and lifting your leg with your arms, not lifting your leg with your leg, and holding it up there with your knees straight for 60 seconds to tolerance. You want to bring it up to the extent that you can tolerate it. You don't want to go more or less. You'll feel that stretch in your leg as a result. Hold it for 60 seconds and repeat it. But additionally, things like abdominal crunches are exercises that spinal stenotics can do to strengthen their abdominal musculature. So those are some exercises. In addition, there is an exercise where you can use a fit ball, which is that big exercise ball. You can put it in a corner, lock your legs in the corner, put the ball basically under your abdomen and chest, hold your arms behind your neck, and gently arch to what's called neutral spine. In other words, you want to be straight out. You don't want to go into extension. You don't want to arch backwards, but you can roll over the ball and go to neutral spine and strengthen those paraspinal muscles. These are the core exercises that I would recommend for a spinal stenotic who has pain with extension and often will have nerve pain or weakness in their legs with prolonged upright walking. Additionally, riding a bicycle where you're bent over forward is an exercise that a spinal stenotic can do because you're opening the spinal canal and opening the neuroforamen where the nerves come out to the side. So spinal stenotics can tolerate riding a bicycle where you're bent forward. And some spinal stenotics even tolerate those turn-down racing handlebars on a 10-speed because their spinal canal is maximally opened. So that's what is good for those folks. In contradistinction, people who have pain when they bend forward. When you bend forward, typically you're increasing the pressure in your lumbar disc. Sitting and bending forward increase the pressures and cause those lumbar discs to bulge more. So those folks are going to have more sciatica when they're sitting or bending forward or tying their shoes. And so what can they do? So ideal exercises, and we talked about walking, for people who have, we'll call it a discogenic lumbar spine. Inversion table is a great exercise for somebody like that because it distracts the disc and reduces the bulge and opens the spinal canal, whereas that's not a good exercise for people with spinal stenosis. Other exercises that can be done for people with disc problems include that abdominal crunches. You're in a neutral spine condition when you do crunches, so you're strengthening your paraspinals. We talked about back extensions over a fit ball or physio ball. For the person with a disc injury with sciatica or a disc bulge with sciatica, arching backwards more completely is a good exercise for them. So you can go past neutral spine. There are other exercises that can be done for people like this. We talked about the passive straight leg raising that's good for spinal stenosis, and that's also good for people with disc injury, referred to it as neural flossing. So you're lifting your leg up with a strap under your arch, your arms are doing the work, your leg is along for the ride, your knee is straight, and you're holding it for 60 seconds and repeating it once. You can do it on both sides, it's fine. There are other exercises that can be done, abdominal crunches we've talked about, but there are exercises that are hard to describe. One is called bird dog and the other is called Superman. Bird dog, you're lying over a fit ball, or you can do this on your stomach and you reciprocally extend the opposite arm and leg up into the air. And you alternate this. I find this to be best over a fit ball. You're strengthening both your paraspinals and your abdominals at that time. And this can be done a couple sets of 10. When you get really good at it, you can add arm weights and ankle weights to the regimen to get even stronger. The same exercise can be done on your back, where you're reciprocally bringing your opposite arm and leg into the center and then extending them and switching from side to side. And this, you want your back to be flat on the ground, not arching when you do this exercise. And this, again, strengthens your abdominal muscles and your paraspinal muscles in your back. Quote unquote, core stabilization exercises. There are many other exercises that can be done, but these are the hallmarks of exercise that will help your spine. And again, I am a splitter, not a lumper, so I think of people who are intolerant of bending forward as requiring one type of exercise, and those who are intolerant of arching backwards requiring a different set of exercises. Hope this helps.